beautiful. My name's Kylie. I'll be your nurse, okay? Can you tell me what brought you in today? Productive cough. Okay. Oh, I'm starting to cough up some blood today. Okay. Well, I'm going to wash my hands real fast, and then I'll do a quick assessment on you, all right? So as I'm washing my hands, I just want to make sure that I am doing a quick QSIN in the room. I'm going to look and make sure nothing's on the floor that would be a trip hazard for her. I'm going to do a quick look on her, look at her general appearance, make sure I don't see like an IV running, a Foley or anything, if she's on oxygen. So I'm going to wash my hands. All right, hon. Can you tell me your name and date of birth? And as she does that, I'm going to look at her bracelet to make sure she is giving me the right information, which she is. Okay, and then can you tell me where you are? Correct. All right. So I'm going to have her turn her head. I'm going to look for JVDs. Turn your head towards your right. No JVDs are present, which is good. I'm going to feel her skin, which is nice, cool, and clammy. Her skin looks pale. Besides the cough, are you having anything else? You're having some night sweats. Okay, I'm going to say you are pretty sweaty. So I'm going to feel her pulse real fast. Her pulse are present and even on both sides, bilaterally. +2. Check her turgor, which her turgor is good. I'm going to check her capillary refills, which are excellent. Any numbing or tingling in your fingers? Nope. She wiggles those are good. I'm going to go ahead and grab your vitals real fast, okay? So I'm going to go ahead and grab her temperature. Okay, which her temperature is 101.2, so you do have a fever. As I was going to feel her pulse, I'm going to go ahead and grab her pulse real fast. I will count her pulse for a whole minute. After a minute, I got 92 for her heart rate. And then I'm just going to pretend that I'm still counting so that way she doesn't change her breathing. I'm going to count her respirations. I would count those for a minute also. After a minute, I got 24 for her respirations. I'm going to go ahead and grab her blood pressure, which put this on her arm. Make sure that I pump it up and slowly release it, and grab her blood pressure, which for her blood pressure, I got 146/78. And then I would check her O2 stat, and for her O2, it was 90. So your O2 is 90, so that's a little low, but not too low, okay? Are you in any pain? No pain? Okay, so she denies any pain. She's already told me about her cough. All right, I'm going to listen to your lungs, okay? So I'm going to have her lean forward. I'm going to listen to her lungs. Okay, I'm going to listen to your fronts. Nice deep breaths. Okay, over here, I'm going to go ahead and listen to your heart. So I'm going to just listen to her apical pulse, which is nice and strong. I did notice that on her right upper lobe, it is kind of rocky-eyed. So make sure that I would note that too. All right, I'm going ahead and listen to your stomach, okay? So I'm going to lift up her shirt. And while I have her shirt up, I would take a quick appearance of her stomach to see if she has any scars, any dressings, or any wounds, which she doesn't. So I'm going to go ahead and listen at her left lower quadrant. And I will go up And then to her right, go down. Which she does have bowel sounds in all 4 quadrants, which is good. I'm going to go ahead and feel your belly, okay? Any tenderness? No tenderness? All right. And when was your last bowel movement? This morning? Good. Normal? Okay. Besides your cough and sweating, do you have anything else? Just kind of like night sweats and sweating, weakness. You lost 20 pounds in the last 2 months? Okay. So I'm going to make sure when I do her documentation, I am going to put all the information that she told me. I'm going to go ahead and feel her legs. Her legs are also nice, cool, and clammy. I'm going to go ahead and feel her pedal pulses, which is present bilaterally +2. Good. I'm going to check her capillary refills on her toes, which are excellent, less than 3. Can you pull up? Good. And push down. Excellent. And then can you wiggle your toes? Good. Any numbing or tingling when you do those? Nope. Okay. So, I'm just going to ask you a few questions, okay? Do you smoke? No smoking. Do you live in like a nursing home? Have you ever been to prison? Have you been around anyone that you know that has TB, tuberculosis? Have you traveled anywhere? You have traveled somewhere? Okay. Africa? Okay. So, I'm going to document her assessment in the correct format, date and time. I'm also going to, for her history, medical history, make sure that I do put that she has been to South Africa. She has sweats, has lost 20 pounds, has a temperature. So I do want to make sure I do let the doctor know about that. Okay, and then document her vitals also. All right, hon, and I'll be right back, okay? Do you need anything before I go? Nope, okay. I'll just make sure she has her call light before I leave. Okay. All right, Miss Bull, hi, I'm back. So I talked to the doctor, and the doctor has ordered some tests, okay? He wants you to get a chest x-ray. We're going to do a sputum culture. We're also going to draw some labs, and we're going to get some blood culture from you. And then I'm also going to do a PPD test, which is just a little skin test, okay, to see if you've been exposed to tuberculosis, to the TB, okay? I'm also going to put some oxygen on you because your stat, like I said, was only 90. We want that at least above 92. So I'm going to put some oxygen on you. And then he did order some medications, and I will get that for you, okay? I'm just going to go ahead and hook you up to your oxygen. So I'll make sure, put on oxygen. I'll put on 2 liters. Nasal cannula. So I'd put that on her because we definitely want to get her oxygen up. That's very important. And then I'm going to go ahead and get your medication ready for you, okay? So I'm going to wash my hands and grab my supplies. I'm going to make sure that I have the medication, I have my alcohol swab, and some gloves. I'm going to go to the computer, pull up her chart. I want to make sure that I am in the right patient's room and giving her the right medication. So can you tell me your name and date of birth? Which her information is correct. And are you allergic to anything? Nope. Okay. So the doctor did order you some Rafetin, which this is going to help with the TB if you do have it. I'm going to give that to you right now. That's 600 milligrams, okay? And that's going to be by mouth daily. He also ordered you other medications, but right now I'm going to give you this. This can make your sputum or the urine kind of like an orangey red color, so don't be alarmed. And you can have like a flu-like symptom, okay? And another thing, this can cause hepatitis, okay? You have any questions? Oh, okay, So it's going to be 2 pills, like I said, 600. So I'm going to go ahead and wash my hands real fast. Wash those. I'm going to put my gloves on before I handle her medications. Alright, got my gloves on, got her medication, so I'm going to pop this in her medicine cup. Okay, make sure I don't drop those. I would scan the barcode and the computer. That's another way to check it too. So here's your medication. And here's some water. So I give her meds, give her water, let her take those. Alright. And then I would document correct format, the medication, date and time, what medication she received, the amount of it, the route of it, and if she has any allergies. And then, okay, and then I'm also going to do that little skin test, okay? So for this, I would need a tuberculosis needle, but I don't have one, so I'm just going to use this. I'm going to draw up my medication, about 1 ml. I'm going to have my alcohol swab. I'm going to clean off the top of the vial. This is a multiple use. So we're just going to put a little bit of air in it. Like I said, we're just going to draw up a little bit. Medication. Make sure I have that. And then, is there a certain arm you would like to use? You use your right arm. So for the TB, for the PPD test, forearm is one of the best places to go. So I just want to clean off with her alcohol wipe and a circular motion and clean off an area in her forearm. So we got that nice and clean. With this, we're not going to go at a 45-90. We want to be more parallel to the skin because it's a dermal test. So about 10 to 15 degrees is all we want to go. So just make sure I go very close to the skin. Like I said, no more than like 15 degrees. Once I'm barely underneath the skin, I am going to administer the medication. And when I do this, I want a little welt, kind of like a bee sting. That's what I'm going to be looking for to make sure that I did it right. And we got that. And we don't want to rub it, massage or anything. I'm going to take just a little cotton ball. I'm going to place over it and tape it just to keep it nice and safe. So when I document that, I want to make sure that I document the correct format, the date and time. I want to document what I used, the arm, how she tolerated it. And I want to make sure I tell her that she needs to come back within 48 to 72 hours. We got to read this. If it's over 10, that means you're positive, okay? That just means you don't have TB. You just have been in contact with it, okay? The sputum culture that we did, when that comes back, that's what confirms if you have it or not, okay? Do you have any questions? Okay. So gave her medications. I let her know what it was for, side effects. I did her PPD test, let her know when to come back for that, and educate her for that. All right, hun. All right. That's all I need to do. If you have any questions, let me know, okay? So I'm just going to clean my mess. Okay. Alright. Hey there, Miss Bull. I'm Kylie again. How you feeling? Good. Still got that cough and stuff. Okay. I'm gonna wash my hands real fast. So it did look like your test came back for the tuberculosis, and you are positive. Okay. So we're going to start you on the medications. We are going to admit you to the hospital. Okay. We're just gonna keep you here. Keep a closer eye on you. Okay. So we're gonna transfer you to one of our medical surgical floors. Okay. We're going to put you in a room that's a negative pressure room. And when people come in, they're going to have to wear a mask, okay? And that's just to help protect them and protect you, okay? So we're going to head and transfer her to upstairs to the medical surgical floor, put her in the negative pressure room. After 3 weeks on her medications and stuff, she's no longer showing signs and symptoms. She's about to be discharged. So before she gets discharged, I do want to go over everything with her. So knock in the room. Hey there, Miss Bulls. Kylie again. How you feeling? You look a lot better. Good. That cough's kind of gone down a little bit. Good. Can you tell me your name and date of birth? And as she does that, I'm going to make sure that I do look at her bracelet once again. She's giving me the correct information. Can you tell me where you're at? Good. So I'm just going to go over some teaching with you, okay? Go over your medications and everything. So as I go over her medications, I do want to point out the importance of her medications, why we're taking them, for how long we're taking them, side effects of each one. The reason why we do take these is because it helps to make you not where you're no longer able to spread it, okay? And if you keep taking your medications like you are supposed to, then it kind of helps you be disease free of it. Let's cure it a little bit faster, okay? We want to make sure that you are taking some iron because it does affect your liver enzymes. We want to make sure you are eating a well balanced diet. We just want to educate her on everything that she needs to do. If you go in a crowd, make sure you wear a mask, okay? That's very important. Get plenty of rest and sleep, okay? And diet. Like I said, you'll be coming in every couple weeks. We're going to check your liver enzymes, and we are going to check your sputum to make sure that the medications are working and we don't have to add any more, okay? Do you have any questions? No? Okay. Make sure I would document in the correct format that date and time of her discharge education. And then we'll be leaving here soon, okay? All right, have a good one.